August of 2020. And I do want to point out that you'll notice on these slides on the very bottom corner, although I don't see it there, but it says a living document. And the reason why we put the living document is because, as you know, things are still changing day to day in regards to the guidelines from the Fresno County Department of Public Health as well as the state. For example, just last week, the governor put out the executive order of requiring masks, and so we have to reflect that in our current work situation, and should that change by the time of August, then that would change. But tonight's plan will be addressing that issue. So again, a living document that will be very fluid and flexible. So we go. And thinking about how we're going to reopen our schools, we wanted to make sure that our focus is going to be on the safety and well-being of everyone, and our children and our staff. Also, though, while ensuring that our mission of educating our children remains the priority. That, our school district's mission has always been ensuring student achievement and high student achievement. So that will again be our mission, and now the focus, though, is shifting on that safety. So this timeline to reopen, basically it just includes the steps, and I apologize if that's not very large, but basically what this is saying is that the steps we're taking to work with our team members, work with our staff, gather input from stakeholders, and then present this tentative plan to the school board tonight, with knowing that there will continue to be revisions and adaptations, again, as we move through and see what the Department of Public Health is requiring, and in our county in regards to the number of cases. And before school opens on August 20th, the plan then is to have our school site leaders present their own individual communities, school communities, the specific plans on their reopening, because we know that every school has a different map to it, different classrooms, different logistics there that would be presented. So some of the fundamentals that we keep in mind when we're planning our reopening of our campuses. The first one is to remain very student-focused decisions. We are looking at how do we make decisions that are best for our children. Also, the flexibility and expect change. We know that our plan has to be able to be adapted at a moment's notice. So when I explain all the different options, we should be able to move fluidly within and out, and we also should have allow our parents that choice to go in and out as well. Ensuring equitable access for all. We did a lot of work around the digital divide and ensuring that our students had the digital access, but the equity is always a concern for us when it comes to ensuring that students that are having to be at home are receiving the support and the guidance that they would as if they were in the classroom. Collaboration with stakeholders. We have done a parent survey, and I'll share some data on that. We've worked with the teachers union on a teacher survey, as well as I had a virtual superintendent forum, and working with our school site leaders and our teachers. So we are continuing with that collaboration with stakeholders as we move through the process. A commitment to safety. We want to ensure that not only the physical safety of all is important, but also our social emotional safety as well, our mental health. And then the frequent communication. So as moving forward, this week I'll be doing another communication out to the community after the school board presentation, letting the community members know about this plan and giving them access to this living document. So here's some results of the parent surveys that were sent out about the last week of school. We had over almost 2,300 responses, and parents had a week to do this. We did to remind them about, we really wanted their input. One of the questions had to do with the comfort level of parents. How comfortable were they to send their children back to school? And 2/3 were comfortable or very comfortable, but you can see about almost 30% of our parents at this time are not feeling quite that comfort in their kids returning to campus. Then we asked a question about registration. If they had to register their child, would they send them to the school with the safety requirements required? The distance learning, that would be an option. Homeschool, which would be, of course, our charter school. And you'll notice 12% were undecided. We included a time for them, a question there. If they were undecided, what would they need to know in order to make their decision? Many of the comments centered around masks. If their child had to wear masks, they weren't sure that they would want them to go. I think that was probably the majority, if I'm looking at Dennis, because I know you reviewed all those comments, that was probably the majority concern that the families had were about face coverings. So moving on.
Wait,
Oh, go ahead. Any questions? Yes, stop.
Saying face masks, they said that they had a concern. They had a concern with face masks. Was it wearing a face mask or not wearing?
Wearing. So with this,
They wanted their child to wear a face mask?
the comments that we received were more around not wanting their child to wear masks, not wanting to come back to some of the language that I think they commented on there was like a military style setting where, we've seen pictures, we've seen examples from other countries of how they're reopening their schools. And I think those images that maybe, those parents had seen, that was a concern from them about just kind of that, such a tight structure, military, wearing masks. That was a concern for them, that if they had to return to that type of environment, they weren't sure they were ready to do that.
So it was mostly not wearing. They didn't want their child to wear.
Right. They were concerned that their child couldn't wear the mask. They won't keep them on, they'll touch their face, more of those were the concerns on the undecided. But 64% are ready to send them back to school. Okay? So looking at the different, that's the wrong, go down. That's the wrong insert.
One thing, 64% on that one was saying return.
Yeah.
The first one was 70%.
So there was one, go back to the data. So the comfort level is how comfortable they were. You will notice that about 70% are comfortable or very comfortable in regards for having their kids back on campus. Again, if the undecided were factored into the send to school with safety requirements. So I feel they're comfortable sending their kids to campus if it's not going to be maybe so military style. Or do they have to wear a mask? What if my child doesn't want to wear the mask and I've tried my child wearing a mask, they won't keep it on? So those were kind of, I don't know if I could. The next page was not the right page to be on there. So let me go ahead and I'll make sure that the corrected copy gets up there as Jennifer tries to find the corrected copy. But we have possible options, and we wanted to group them as an on-campus options and off-campus. So the on-campus option, when we took into account the number of parents, if it's a 70%, we could just leave it there, and there's 2 on-campus options. If we come to the 70% where students would want to come back to school, then we have mapped out classrooms at several elementary schools and the middle school and the high school to maximize physical distancing for students. We are looking at trying to get all our kids back to school every day because we believe that our children need that education, need that daily contact with teachers daily contact with peers, albeit it will look differently. It won't be a traditional look to our schools when children return, but we are looking at how can we maximize every physical space so that if parents want to send their children to school, they can send them to school knowing we will do everything possible to keep them safe. The other option that didn't get up there, though, was the whole idea of dividing the groups into two different groups, the kids into two different groups, where it would be a hybrid model, half the time on campus, half the time at home. There are disadvantages to that model in the sense that kids would still have to be home. Parents would still have to find a way to have caretaking for them, as well as for them to be learning at home. That struggles, the challenges that we heard from the initial closure of our schools. But we wanted to, let the board know that, and I'll get the corrected copy to you that I have both of the sessions here, but students would be at school only 2 days a week, home 2 days a week, and the 5th day would be used for intervention and intervention groups. But with our on-campus option, we do want to ensure that we have the ability to bring our kids back, should our parents want them and feel safe that they're back, like the 70% that said they would. And off-campus options, our distance learning would continue, however, it would be a more robust and well-planned out option. The closing of our schools had some limitations to us, with one of them being how quickly we had to do it. The other one is that the state put out the memo that it was going to be a hold harmless to our students, so no grading and very limited amount of new learning that could go on. So we, over spring break, when we realized our schools would not reopen for the remainder of the year, our Tim Lopez's team worked very hard with the teachers, and the teachers did amazing. I know that was mentioned earlier, just learning how to use devices, learning how to use some online platforms that they never had to use before, and learning to still reach out to our kids, check on our kids, and do that teaching. This distance learning model would include daily contact with students, both live contact online with online platforms, and then also would include independent learning at the same time. But they would have daily contact and have those daily or weekly services if they were to receive any type of speech or any kind of other outside services. If they had an IEP, those needs would be met with that as well. And then, of course, we have our Hallmark Charter School, which we're very proud of, and that's our Sanger Unified K-12 homeschool charter. And that's different than the distance learning in that the parent is the designated teacher for that child, and then they coordinate with Hallmark where they get a weekly check-in with a Hallmark teacher. So again, on-campus option and an off-campus option. Go ahead, Mr. Hernandez.
The distance learning, would that be with a classroom, like one teacher with a number of students?
Yes, so we would assign, we're really looking into Taft School being able to be the school where they're housed, because we already have a school that does similar to this, but we can make it, again, more robust. It would be a teacher assigned to either the 32 or the 34 students that our contract allows for.
The Hallmark Charter is it's Hallmark Charter, so I understand that.
Okay.
Okay, going back to the students coming to school every day, would there be different levels, like say kindergarten would be spaced so much, first, second spaced so much, fifth, sixth spaced so much, and like that?
So maximizing the physical distancing to the extent possible, we would take most every furniture would be coming out of the room. That means that the classroom that we mapped out at Jackson had a teacher's desk, a bookcase for the teacher, file cabinet for the teacher, and the rest were desks, student desks, wall to wall, corner to corner. We could fit 25 in there, which is your standard primary size. That's what we staff our primaries to, 25 to 1. And taking into consideration about a quarter of our students, if we say 25%, will choose distance learning. That's removing already 4 to 5 students.
Would a sixth grade class be 25 students also?
We would have to see what our registration would be. If we can fit, our classes are all different sizes, so we would look at our classrooms and determine some are in portables, some are in very large rooms. And then we also would have to look at, to balance out our classes, there might be some busing, because we do have some classes at some school sites that are already, they were low in number last year. Like we had a kindergarten classroom, I think, with 8. Didn't we have a kindergarten class with 8? We had a first grade classroom with 14 last year. So it might involve some busing to even out those numbers. But the maximizing, you will notice that we're not saying every classroom would be at 6 feet. If that's what, and it's the measuring they say is nose to nose. Some might be at 5.5, some might be at 5 feet, but we'd be very honest and transparent with our parents that that's what it would take to get our kids back in.
Yeah, because that's my question. When the survey went out, did parents know that we'd be talking about maybe possibly bringing students as close as 4 feet as possible, 4 feet?
We weren't specific on that, no. We just mentioned about the guidelines. But this is a team effort, so I want my team to chime in because they have thoughts about this too, and it's definitely been a team effort.
Mr. Hernandez, to that point, in the upper grade, in order to try to maximize that social distancing and also provide choice for the parents who want to come back, it could go to as low as 4 feet. And you're right, it wasn't in the survey, but as we collect the data now, as we call and find out which model they'd like to choose, we want to make them completely aware, depending on the physical space in the classroom, it could get as low as 4 feet. When it go below that,
Collect the data,
I'm sorry?
as we collect the data.
Well,
Registration.
yeah, we've talked about 2 different options, whether through the registration platform, where they fill out their registration for coming back to school, perhaps a question there, or even as much as having our staff on compensation make phone calls to try to collect as much data of who's ready to make their choice of which option they want to be on. And then begin to build the schedules and accommodations for those who wish to return to the school 5 days a week, those who would like to continue a distance learning platform at TAP School, or those who want to enroll at Hallmark Charter School. But be completely open about it.
Our goal is to make contact with every single parent.
I think our goal, the overarching goal, is to provide choice for our families, to be completely transparent with the details and the logistics of how we can accomplish what they'd like to accomplish. And we think that to do it expeditiously so that we can plan, because there's 57 days before the first day of school as of today. It'll be quick, it'll come quick. So we need to begin to work on logistics, because in these settings, we have to transition to individual school desks, all facing the front. And where now we have school sites that don't use desks at all, they use group tables. So purchasing desk, material, equipment to outfit those classrooms, as well as storing kidney tables, other shelving units throughout the district is also going to have to take place.
Yeah, because I know when you're talking about registration, you're only talking about a very low number.
Potentially, and it's a 3-week window.
We're opening it up starting Monday, and that will be included in my video message encouraging our parents to register, and that we will do outreach as well to our parents, because we might find that they're not comfortable with that physical distancing, and so we would have to revert back to an AB model if they're not comfortable with that. If they know, like Mr. Hernandez, like what you're saying, if they're saying, oh, well, we didn't realize that it wasn't all going to be 6 feet. But the thing too is, as we've discussed this, is the 6 feet is going to be difficult. That's to do any time of the day. When we think about 5-year-olds, 6-year-olds, 10-year-olds, 13-year-olds, 16-year-olds. And, you know, we know that they want to be with their peer, they want to be with their friends, so that our parents would have to know that being able to guarantee a 6-foot distance throughout the entire day would be very challenging to do. I don't think we could do that. So to say we could eliminate all risk, but we can definitely, is probably something we could not guarantee, but we could definitely reduce it and minimize it. And we have a lot of other plans as I go through the slides that will show how we will do that.
My concern, and I want to make sure I say it in the open medium right now, is that my concern is not really the space. My concern is the number of students that are going to be in the classroom. The big problem is control. The big problem is control. Can you control 16 students better than you can control 25? And I know you can. It'll be easier. So that's my concern, because I do not want to go back. Okay, and I know this is very, I know parents want our kids in school, but I just want to make sure that we're going to give for them to be safe. Not only the students, but also their staff, our teachers, our classified employees, and make sure that their staff, they're safe on campus. Because otherwise, and I'm very afraid for this to happen, because I know right now we say that our medical people are the ones that are in the front lines right now, working with all the people that are ill. And it's them that are our heroes and are like that. I just don't want it to be when our teachers and our classified personnel are put in that kind of condition, in that kind of situation. I'm very concerned about that. I just want to make sure that we're very, very careful. And I'm glad that we're saying that it's a living document, because I know it's going to change. Hopefully it will change one way or another. Hopefully everything will be gone by then. I'm very concerned about that. Thank you.
The one thing I want to point out in the distance learning that I don't think I mentioned was the high school. Sanger High School would run its own distance learning plan, so that the high school kids would be still associated with Sanger High School. And the Taft would be for K-8. Okay. So some of the areas that we were addressing and really having to think through and consider, and we're still doing that, is not only the instructional program, but athletics, special education, our technology, social, emotional. You can see just the different areas that I tasked the team to look into and come up with some plans around this. This is, again, the work that we're going to be doing throughout the rest of the summer. And these things will happen no matter if all kids are able to come to school or only if half of our kids will be able to come to school. So the plans as we move forward are going to be the same. So social emotional wellness, what are some of the areas that we know as our kids come back? We've heard from parents about their concerns that their children have not been able to manage the safety, their worry, their concern. So again, kind of to that point that we know our safety of our kids is going to have to be addressed alongside academic learning. I think that was something even our parent mentioned tonight. So what are the steps we're going to make sure that we do have those positive behavior intervention and supports, like coming to your point too, Mr. Hernandez, is how do we reteach them the behavior expectations and the different behavior expectations as we come back to school. A lot of time we see is going to be spent doing that with a lot of our supports from our school psychologists and counselors. Looking at providing some mindfulness and trauma-informed practices training. So teachers have asked, how do I help our kids when we come back? And so we do want to ensure that teachers feel supported in how they're going to be able to do that. And mindfulness is something that really has, we've introduced, and some teachers have already been doing some of that with their classes before COVID happened, and have been seeing positive results on how can kids just kind of take a moment, and it might be where the whole class takes a little moment, 2 or 3 minutes, just to kind of do some self-calming and reflection and thinking. And then also looking at that for those kids that choose distance learning, or the parents that choose distance learning, we will have that virtual service platform. So no matter if students are with us or students are at home, they're going to still get that same type of support and services with counseling. And then also ensuring that we have our social emotional curriculum will be available for teachers to use, and also ensuring that our school psychologists and counselors can lead and go into classrooms and help the teacher lead some of these activities, check in with our students, and ensure that their social emotional needs are being met so that we can address their academic needs. So we do know that that has to be one of our priorities. Facilities, some ideas and talk we've had about our facilities is, again, maximizing our social and physical distancing. We're going to minimize classroom furniture, so that again involves removing kidney tables where we typically would see small group instruction, and arranging our classrooms where they are all facing in one direction, spaced out. And then we've also learned that air circulation, open windows, fans do a lot to maximize that air circulation, and that's what's been recommended. So we are going to be doing that as well. Food services, so our nutrition. One thing we wanted to make sure that our parents do as well, that if they choose distance learning, that their meals will still be provided, just like we've done through the closure of our schools and throughout summer. We will have non-congregating lunch periods. That means we need to separate out where and when students eat. Weather permitting, there might be times when kids can have their picnic lunch outside. Other times we are looking into how can we provide lunch in the classroom. Pretty much sure we're going to be having breakfast in the classroom, but how can we provide lunch in the classroom to minimize that big group, because we know we cannot fit them all in the cafeteria at once. One principal, I think today, said they would have to start lunch at 9 in the morning to kind of have them all cycle through the cafeteria. Also cohort lunch groups, making sure if all of our grade levels eat together at one time. This will have to be mitigated a little bit differently for WAMS and the high school. We're currently working with the leadership at the high school. How are we going to have locations dedicated for groups of students to be sitting out and not where they're constantly just intermingling with each other? The curbside pickup has to do with our distance learning students. And then also looking at our menu as being a fixed menu. Also taking into account any medical or allergic meals that our students need to have. But the fixed menu, typically, our lunch has been a salad bar. Kids can go up and choose what they want. There's multiple meals to choose from. But it will be a fixed menu, so the student gets their meal, and there's not going to be a lot of that interaction with the food service people about what kind of food do they want to eat. And food service personnel will have all of the personal protection equipment on at the same time. Some campus logistics. So what is it going to look like when our children comes on school? So the guidelines have provided where we could either do passive screening or active screening. So passive screening requires parents to screen their children at home before sending them to school every day. So our plan is to start with that, provide our families with a video and a guide on how to do that passive screening. And then as students are coming onto campus, we will have designated areas students can enter campus so that we will also do some visual screening. If we see a student who maybe is coming to school, let's say coffee, or not looking as healthy as they should, then we would discreetly have them go into the health office there at the school site. We don't want to stigmatize kids and call them out there in front of everybody, but again, this is going to have to be a partnership with our parents, and we're going to have to switch to that idea that it's okay if kids stay home if they're not feeling well. I know that we've always said if they have a cough or if they have a runny nose, send them to school, they'll be fine. But we're going to have to come to this mindset that it's okay if your student is not feeling well and they can stay home, especially with the fever. So that we would work together with our families on that. Recess groups would be with a staggered schedule so that you don't have all the kids out at recess at once. Hand washing and sanitizing their hands prior to playing and also prior to returning to the classrooms with scheduled cleaning of the playground equipment. And face coverings as required by state protocols right now, so they would be required. So students at this time would be required to wear face coverings. With that being said, if students fidget with them, take them off, we're not going to discipline students if they take off their masks. We're not going to send them to school. We want to use that as an opportunity to teach our kids about that. Use that as an opportunity to teach what are the layers of defense that we have and for safety. And then, of course, work with our families on that as well. And should the governor release or remove that restriction, then we would address what would that look like at that time. But right now, that is a restriction required by the governor. Signage, posters everywhere. You may have noticed coming into the building tonight, we put up extra posters. We would have those, again, all over our schools to remind people of the social distancing. And the library would be limited to allow for the maximum distancing in there. We are also looking at, we know the library can't be a constant flow of kids, but we want kids to have access to their books, especially for reading, so we would also, the library could push into classrooms. And schools, as we begin this, we would limit our outside guests and visitors, and also require face coverings. So working with our families again, if they need to come on campus to schedule appointments, and that way we can limit the amount of people in the front office. Any questions so far that I'm going through? So athletics and co-curricular. So currently, as you know, our varsity teams have started practice. And JV starts tomorrow. And so we are following the guidelines that come to us from the CIF, as well as the National Federation of State High School when it comes to our 7th, 12th. And so they had a return to practice guideline, and sometime in mid-July they should be coming out with a return to play guideline. So we'll be following those guidelines for our 7, 12. Elementary athletics right now will be postponed. So we won't be starting off with our typical fall sports in elementary. We really feel the need to focus on our academic day and ensure that our kids are learning the new routines and our staff feels comfortable with the day before we begin athletics in the elementary school. Good question?
That's district athletics.
District athletics.
It doesn't affect the private ones out there that set their own standards, like
Right.
soccer.
Yes, so the soccer leagues, this is our fall sports, typically are football and volleyball and cross country. But we are saying postponed because, again, we want to focus on the academic day, making sure how that's running before we introduce all of that. With that being said, though, we will also have LEAP. LEAP will still be in place for students who typically are involved in LEAP, our after-school program. The co-curricular activities will be determined on a case-by-case basis, so our clubs, especially this is relevant at our middle and high school with clubs, after-school activities like that. And then field trips right now would be postponed. Busing. So we are looking again at face coverings being required on our busing. We can put 2 students per seat. Typically we jammed in 3, I think. So We're gonna limit that, space them out as much as possible, and have constant outside airflow, so windows would be down, even when it's hot and the air conditioner's on, their windows will still be down, and sanitizer as children enter and exit the bus. Custodial. We are increasing hand sanitizing stations and hand washing stations around campuses. And I know that in the past we've had hand sanitizers in our classroom, and many times people will say, well, there's no hand sanitizer, it's empty. So that frequent insurance that all of the supplies will be refilled every day to ensure that we don't run out. Fogging of all of the work and instructional settings, including the playground, would be done. That's we've gotten even more machines. I think we have machines galore now to have several at sites, right? And with the fog juice, and so what that does is it just goes on and sprays all the equipment. It can spray right on top of paper, right on top of any equipment, and it just dries and it kills and sanitizes any type of virus. Again, I mentioned the additional hand washing stations, maintaining hand washing supplies at all time, but kind of earlier with that, I think we talked about teaching our kids the new routines of school. So we'll be working with our parents again to work together on teaching our children how to properly wash hands, and then we would be doing that at school. Technology I wanted to include because of the families that are choosing distance.
Now let's move back up to that.
Sure.
On the custodial, how are we handling the PPEs on that?
Excuse me?
How are we handling the PPE for the staff?
So the state has sent to all of the school districts, they're supplying all the school districts with PPE. And ours is actually in Fresno County, we should be getting it any day. There's about, I don't know, Ryan, you might remember the exact numbers that we're receiving. And do you want to come up and address that question? Because I know that you're working on that. We've been looking at, in fact, one of them is the mask that I was wearing earlier, to try to look at all the different type of PPEs that are going to be offered. So, want to address that question?
Absolutely. Thank you, Mrs. Jones. We are getting some stuff from the state, and we have been way out ahead of looking. Everybody's getting into the game and contacting us. So, everyone has masks. We have face shields available. Obviously, we have nitrile gloves. For the basic disinfecting, there's really not much required, as far as using the chemicals. And what we've got we've moved to a high volume fogging sprayer that gets a great coverage of the entire room or the entire space in like 30 seconds. So to answer your question on the PPE, face masks, of course, we have face shields, and we have plenty of nitrile gloves, and we will continue to stock those well in advance. As Mrs. Jones spoke to, the state is also sending us some stuff. We're expecting to receive it pretty soon, which is supposed to include a face shield for every single teacher. It's supposed to include 2 cloth face masks and 2 paper masks for every single student, according to our ADA, and then about 14 gallons or something of hand sanitizer, which isn't really enough, but we have been securing a lot of hand sanitizer at a lot of stations. I believe that our most efficient and most effective method in cleaning things is using the fog machines, which is why we've sunk some investment into some larger machines, and then we've also procured the chemical solution that mixes. I've got about 200 days worth to do the entire district, every space, and then we've got another order that will back that up.
Technology in regards to our distance learning, so those families that choose distance learning, you can see we already have our iPads out. We do know that we'll be getting new students. We did not collect the iPads throughout the summer because we were also offering more support for parents over the summer should they choose that. We did already distribute about 200 MiFis to families who did not have access to the internet. And we currently have an inventory so that when school starts up and we have new families that have joined us, that we are able to address any lack of Wi-Fi access. And we have a full technology support team for all staff, parents, and students, no matter if they're on campus or off campus. We wanted to make sure we address that for the distance learning families. And that's our last page, right? Yes. And that is our living document to this point. The question? Yes. I will put that out. I will also send it to Cheryl. I know Cheryl probably, I saw you taking pictures, but I'll send that all out. We'll put it up on our website too. We'll put that all out there. And then as we get more feedback, then we're able to update it as we move along. And working with our principals, again, that we want to empower our principals to determine at their particular site and with their particular community what will work in regards to how you're going to structure your recess time. You know, how you're going to, you know, does lunch in the classroom or does a picnic style lunch, weather permitting, work for you in your space? Or would it overlap with someone else's recess? Things like that. So we've been continuing to work with them on that.
This is on district goals and updates, which is for information only. Will it come to a point where you're going to present something like that and then we have to vote on? Or is it just...
It's the wishes of the board.
Thank you.
I want to make a comment and then I have one or two questions at the end of my comment. We today use words like unprecedented, once in a lifetime event or once in a 100-year event, and COVID-19 is exactly that. You stated earlier that this is a living document, and this is the preliminary of a preliminary document. To be sure, there's going to be multiple changes to this document before it's put into practice by August 20th, the day that we open our school. The COVID-19 locally and statewide and nationally has continued to climb. And it looks like that's going to be the case. Hopefully it doesn't continue in that trend. Hopefully it can come down somewhat. You stated that the information used in this presentation is from the questionnaires we sent to the parents of our students. Were there any other inputs from any other stakeholders other than the parents of our students that was used to consider in this presentation?
Yes, there was a survey, actually 2 surveys sent out to teachers, and that was done jointly with SUDA and the district. So looking at that data, we did see where the majority of our teachers want kids back. And some of it was just on the teachers about their regard, how do they feel about coming to campus and their feelings about safety. And we are working currently this week. We asked CSCA if they had plans to survey their staff and work together with us, and Dennis, or Dr. Wickman, is actually currently working with them this week on getting a survey for our classified staff as well.
Excuse me, the survey for our teachers, you say the majority of them wants our students back in the classroom, and they want to be in the classroom to teach our students.
They want the on-campus option.
Software. Is there a specific number? When you say majority, do you have a specific number in terms of what they preferred for the classroom or on-campus option?
Let me see if I can find that for you quickly. That's a good question.
And while you're looking, you've included Dr. Boya, the county health department, in this discussion.
That's true. So every Thursday, thank you for bringing that up, Mr. Philippi. Every Thursday at 11 o'clock, all 32 county superintendents, as well as the other private schools, faith-based leaders are all included in the call. We have a call with the Fresno County Department of Public Health, and that's with Dave Palmaville and Dr. Vora, where we hear the latest information, and then it's a time for an open Q&A. so where we ask questions about reopening our schools and how can we do this in a safe way. About 2 Fridays ago, I was invited to go to Central Unified, where we were able to be with them and kind of walk a campus and physically see what this whole new structure will look like when kids return. So, my internet's working really slow here, but I have it.
What was the number you needed? The total number is, teachers is 419,
419 were surveyed?
that returned the survey.
419 teachers were surveyed. It's coming up very slow. And then your question was?
Of those 419 teachers who were surveyed, you say a majority, but what percentage of that majority at this time wanted to have on-campus classroom teaching?
They didn't give us the percentage. All they did was give us a bar graph, and this data came from SUDA.
I see. So we don't have the exact,
exact
percentage in terms of what the teachers want.
What
I don't
is the
know.
progress teaching? That should be page 2.
What's it go to?
Because what I wanted to get to is, we have the numbers from the parents, and is that number similar to what our teachers have in mind? Because moving forward, we're gonna need our teachers and our classified staff to work with us through this living document in terms of changing. When August 20th comes around, we may adopt 2 of the 4 options, or 3 of the 4, or 4 of the 4 options, or 1 of the 4. A month later, in September 20th, October 20th, that could change based on the cases, based on what's been happening. It could go up, it could go down. And so the district has to, at that moment, switch to a different option or close several options. And so we need to have our classified staff and our certificated staff to be able to understand that and to be able to work with us in order for us to make that change at that time.
True, and I'll go through this, and I would like to say we probably have the majority of our classified staff, even at work now, right? Because the majority of our classified staff work throughout, our 12-month employees. But we do have like our bus drivers and some, our campus security officers that are not at work. But that's why we had asked CSCA to work with us. We wanted to do it collaboratively to get a survey out to them. So this is the one that we worked collaboratively with SUDA, but SUDA sent it out. And but what this is saying is that the school sites that were represented, so all the school sites, the one that goes way out is Sanger High, they had about 86 responses, but 419 total teachers responded. And then those are the grades that everybody, so it's pretty spread out with the grades. The ones that are down below are like preschool, intervention, adult transition, but for the most part, it was pretty equal amongst the grades. So this is how they gave it to us, and they had put out all the different kinds of possible schedules that there could be, and this is how the data was presented to us. Dennis, you didn't get anything wrong, percentages or anything? Yeah, this one's by grade level. So if I can point out to the second one here, this is like the AB model. That would be the session 1, session 2. You're on campus half day, or excuse me, half the week. And the very last one is the 100% face-to-face. And so overall, the 100% face-to-face got, if you look at all the grade levels, were either the first or second, with TK through, I guess it was through 3rd grade, that was their #1 choice. So as you can see, if it was like their #2 choice, their #1 was spread out this way. And that's the data that they gave us, but they didn't give us percentages. Just more or less kind of like what they preferred. And then these were some of the comments, questions, and concerns. I have 124 total comments. they ranked them like what were the most, 24% were concerned about their own children and childcare. What if I have my own children at home and I have to come to work? The PPE, class sizes, students wearing masks, hand sanitizer, they kind of grouped all of that together at 19%. What would be the expectation of teaching B students on A days? That was, if we went with that model. Adequate cleaning of classrooms, and then how do we address the social emotional learning? So those were some of the top things that we've come out. So as we make our plans, we definitely want to keep those into consideration when we're talking with our teachers and our parents and messaging all that out.
It appears that at this time there's going to be more than one options available to our parents, and if we actually implemented, let's say, 3 of the 4 options, if a parent chooses to, let's say, go with the on-campus option, and somehow later on he or she changes his or her mind, a week or a month or 2 months into the school year, will that parent have an option to switch into a different type of opening, and vice versa as well for home distance to on-campus?
Mm-hmm. I think the transition to if they're on campus and their transition to a distance learning is a much more fluid process, a little bit easier to go into that. To transfer from a distance to a classroom, we would have to make sure that we would have the spacing for that, the adequate, So it might be where when they want to go back into class, it might not be at their home-based school. It might have to be at another school so that we can make sure that our class sizes don't get over-impacted at one side and not at another. We talked about having that time be during a grading period. So really kind of opening it up to all parents at, let's say, a trimester for elementary, semester for secondary, where we can use it at case-by-case basis as we're working with parents, but then have it be like a district-wide opening at grading time, that this is the time we want to make a change, we would make changes. But I think case-by-case, we wouldn't want parents to feel that they couldn't, if they started off on campus and got nervous for whatever reason and wanted to go into distance learning, but at the same time, we don't want it to be just like this open back and forth flow, because that would disrupt the kids' learning, frankly. So.
Thank you.
Anything else?
Just for my curiosity, how many total teachers do we have in the district?
Teachers. Remember.
To just give a relation to.
I know we have over 1,500 employees.
Yeah, I think we're in the range of 500 to 600 teachers.
Yeah, and that also included all of their bargaining unit members, so there were school psychologists, nurses, there were others that were involved in that. So it was a very good representation. I know they were working to collect more, and then also having conversations with them in our weekly meetings.
Thank you.